I was making a video recently and I realized how exceedingly difficult it is communicating complex medical ideas without using any medical terms. So there was this point where I was talking about the diaphragm. Now, I earlier on tried to simplify it, saying that flat muscle and all of that. Well, at some point, I just had to say the word. And when I did, it felt like I've done something wrong, because I always try to avoid the medical jargon, as they would call it. But then it got me thinking, what if instead of the doctors always having to come down to the level of their audience, the general population could come up at least a few inches higher? And I realized how exceedingly easy to make the work of communication. I've witnessed a scenario where a doctor came to see another doctor in clinic just for consultation in his specialty. I saw how different the communication was. Normally, doctors would not bother explaining so much, and when they try to explain, see how basic and simple they try to keep it. In fact, in my opinion, they have not told the patient anything because it's nearly impossible to communicate anything tangible without using the medical words. But when you're speaking to someone who understands, there is always this need to say more, and you see all the knowledge coming out. And so, if the medical vocabulary of the layman expands, health education would improve. Consequently, medical knowledge would increase. I'm beginning a series where I would simplify and break down these complex medical terms. I would explain what the word means and even teach you where the word is coined from. That way, you would begin to see that these words are not so far from your regular day to day words. So, keep watching this space as I break down these words one after the other.